All right, thank you so much. Here, the program still this morning on ITV. Well, the issue of COVID-19 is still ranging in those states and, of course, in other states of the country, even in the world. Just about a few days ago, we understand that the World Health Organization actually came up to debunk the insinuation that has been making around that Nigeria has been delisted from receiving the COVID-19 vaccines from certain pharmaceutical companies outside the country. Of course, it's one thing that is somehow disturbing, very, very disturbing to know that these vaccines are not produced here. Now, as the federal government make preparation to vaccinate citizens, a lot of people are so much concerned that what is going to be the fate of people that somehow they are so interested, but that they cannot readily get these vaccines because the federal government also, brought a list some few weeks ago. They call it a priority list. That list has to do with those that are going to receive the COVID-19 vaccination when the vaccination starts. Now, yesterday, the Minister of Health, Dr. Saigi Hanire, said that the national, that's the NAFDAC, that's the National Agency for Food and Drug Administration Control, is presently studying Russian Sputnik V and India's Covax vaccine against COVID-19. Now, that goes to show that these vaccines may just be the ones that Nigeria as a nation is going to resort to. If anything is to go by, with the statements making around that the Pfizer is not ready to provide COVID-19 vaccines for Nigeria. Well, all these are going to be something that we're going to be talking about today on our discussion segment this morning on ITV as we take a look to see Nigeria's vaccination, the controversies and some of the intrigues. And also, we'll also look at the position of the Edo State government in fighting the COVID-19. Personally, the Edo State government is not resting on its oars to make sure that information is well disseminated for people to actually know that this is real. And of course, the task force that has been put together by the Edo State government is also not resting on its oars. They go around major schools, major eateries, major public sectors on a daily basis to make sure that they enforce some of these protocols so that people can stay healthy. We are so privileged to have Dr. Okwarobo, who is a health practitioner and of course a health expert. And of course, he's the Assistant Incident Manager on COVID-19 to the Edo State government. So you're welcome to this program this morning on ITV.
Thank you very much, and thanks for having me.
All right. Now, before we really hit the topic this morning, what is, can we get your insights concerning when we say that there seems to be some controversies and intrigues surrounding the much awaited vaccination as it relates to Nigeria concerning the COVID-19?
Thank you very much. It's expected that it's a novel virus, and everything around it, there's been a lot of controversy. Okay, in terms of the vaccine, Nigeria is experiencing also a lot of controversy. You reported some issues just now as regards, the rumor that WHO delisted Nigeria, which has been debunked already. So as we move into the coming days ahead of us, we'll begin to see clearer pictures of the true situation. But I must tell you that the federal government, through the National Primary Healthcare Development Agency, is poised to ensure that every Nigerian is vaccinated, at least 70% to achieve herd immunity. And everything is being put in place. The Honorable Minister for Health also came out a few days ago to give us a detailed plan as to how the vaccination is going to go up.
Okay, as it stands now, by just 2 days ago, to precise on Monday, the records are still very, very disturbing. We've got Edo State recorded 54. That was on Monday. We are yet to get the reports for today. So it's still very, very disturbing. Now, Dr. Okwarobo.
Yes, for yesterday, we recorded 25 new confirmed cases.
25?
Yes, so
okay.
Total confirmed cases for Edo is now 4,085.
Okay.
Yes, so we currently have 752 active cases spread across the various treatment centers, and for some of them also in home care. And they are all on treatment, anti-COVID treatment. And we also discharged some of them yesterday as well. So there is a lot of progress in terms of management of COVID-19 cases.
Okay.
Yes.
Now, if we talk about the vaccination, and we also look at the controversies and the intrigues trailing the vaccination that is going on worldwide. Now, can we say, is it not possible for Nigeria as a nation to probably begin to look inward and see the possibility of also having their vaccines? Don't you think it's possible?
Of course. I think there are a lot of local researches going on as I speak. You recall that the African Center of Excellence for Genomic Sequencing in Ede in Lagos was the first in Africa to do genomic sequencing for the COVID SARS-CoV-2. So there's a lot of research going on, and I believe in the coming months we'll begin to see clearer pictures as to what we can do locally here. But what is on the spotlight now is the production of vaccines in the Western world. We have a couple of them. It will interest you to know that as at November last year, we had over 160 vaccines that were on pre-evaluation stage, and as at that same time we had about over 40 that have gone through clinical trials. So after which we now have some of the vaccines that we all know now, like the Pfizer, the Moderna, the AstraZeneca, the Sputnik V. So these are some of the few ones that have gained popularity. But for the local aspect, in terms of Nigeria and Africa, there are a lot of research going on. It's just that the government should put a lot of support, give them a lot of encouragement, so that at least we can be proud to say we produce a vaccine for COVID in Nigeria and Africa.
Okay. Now, one thing that seems to be of much disturbance to people is this tendency for some of these big nations with their technology to probably want to nationalize the COVID-19 vaccines. Take, for example, the Pfizer. We're told that, I cannot mention countries' names here, but we're told that some countries are laying claim to the ownership of Pfizer. Now, the implication of that is that not until their citizens get the COVID-19 vaccines, then of course it cannot spread to other parts of the world. Nigeria is a developing nation, is a third world nation for that matter. Now, do you see the World Health Organization supporting Nigeria in trying to also get its own vaccines, just as other nations?
Yes, of course. In fact, the rumor that was going rounds about the listing of Nigeria, the WHO country office in Nigeria debunked that rumor clearly, and even gave full support to the fact that Nigeria is going to get its share of vaccine. So there is a lot of support for Nigeria and other African countries. You recall that the Honorable Minister for Health stated that Nigeria subscribed to multilateral access vaccine platform, one of which is the COVAX, and also for the AVATS platform as well. All these platforms are to give access to Nigeria to get as much vaccine as possible.
Yeah, we're talking about the production now,
yes,
not getting the vaccine.
Yes,
the production.
Yes, for production,
yeah.
Yes. So it has after production before you can do distribution. Okay, for the production, you know that Pfizer has gained a lot of limelight recently. Of course, if you produce vaccine and you claim ownership, that does not mean that it cannot be used by other countries who need it. So WHO is going in the forefront to ensure that all countries, especially in Africa, you recall also that no African has been vaccinated. It was tried in AstraZeneca vaccine was tried in South Africa, but was taken back because it was not giving the expected outcome as was planned. So as we speak, no African country has started vaccination. So we are expecting that the World Health Organization, through other partners like Gavi, should help to support Africa to get all the necessary, logistics to ensure that we get the amount of vaccine that will give us herd immunity in Africa.
Now, from your own point of view, do you think that the global front against the COVID-19 pandemic, is there any sense of sincerity in it? When we begin to hear of controversies and intrigues, when it comes to vaccination, do you see any sincerity in the global fight against COVID-19?
Of course, there is sincerity. There will be a lot of myths and legends as regards, such developments as vaccine, especially for a novel virus like coronavirus. Okay, but in terms of sincerity, I can say scientifically that the vaccines that are being produced are very potent from scientific studies that we have gone through, all the vaccines. And more research is also ongoing as regards other vaccines. It's expected that we have a lot of vaccines spread across the world. It's not just Pfizer, not just Moderna, not just AstraZeneca, but as many as possible, because we need all these vaccines to cater for the global population. And until we achieve over 70% of vaccination all across the world is still not safe.
Okay. Now let's come to Edo State, where you are so much on the ground, talking about the fight against COVID-19. Now, the numbers come flip-flop, up today, down tomorrow, now, and all that. Now, the state government is not resting on its oars. There's no doubt about that. So why do we still have numbers increasing despite the Edo State government's efforts? I mean, Monday we recorded 54. Only yesterday you said we recorded 25. We don't know what the NCDC will come up with today. So why do we have these flip-flop numbers despite the efforts against COVID-19 in Edo State?
Yes, I would say it's even good we are getting the cases. Imagine if we are not picking up the cases. I'm very proud to say that we have a governor in Edo State that is, proactive. And he has put all machineries in motion to ensure that we ramp up sample collection. And it's the result of that move that we are seeing. If you compare Edo State to other states, you see that Edo State is doing a lot to ensure that we don't miss any case of COVID-19. The more you test, the more you get cases. That's the truth. It's logical. So as we continue to ramp up sample collection and testing across the state, it is logical to get more cases. And as we get more cases, we isolate them for treatment, then we reduce the community transmission as much as possible. So I believe it's the right way to go. It's not surprising to me as an epidemiologist. It's not surprising because this is the way to go. Thank you. Okay.
Now, the weather, the wet season is very fast approaching, and for some experts, they begin to fear that this may also, maybe enhance the contraction of COVID-19. I don't know what preparations Edo State government has on ground to make sure that the worse the weather becomes for COVID-19, the better it is for us, for the fight against COVID-19.
Yeah, in terms of our risk communication activities, we've actually intensified it across the 18 local government areas. We have identified the community informants at the local government level, ward level, and also the health educators across the state to ensure they carry the message of COVID-19 in terms of prevention as we approach the wet season, as you said, to ensure that we continue to practice the basic guidelines, non-pharmaceutical interventions, simple wearing of face masks, and the use of hand sanitizers, and most especially physical distancing. These key basic guidelines, whether it's dry season, whether it's wet season, are all efficient to ensure that we reduce the transmission of the virus to the barest minimum.
Okay. Now, how ready do you think the Edo State government is when it comes to vaccination? By calculations, vaccination may take place from anywhere from the last week of February. That's about 2 weeks from now. Now, how prepared is Edo State government talking about the cold chain storage facilities and all that?
Okay, thank you. We were expecting the Pfizer vaccine. We've not still received. It depends on the storage definition of such vaccines. Like for Pfizer, it's between -60 to -80 degrees centigrade.
Okay.
We have strategic cold chain facilities across the country for that. That's just 100,000 doses for Pfizer.
No, we're talking about Edo State
For
now.
Edo State,
Yeah.
yes. For Edo State, I was trying to comb it down to Edo State.
Okay.
For Edo State, we already have our cold chain facilities that we've been using for routine immunization. So, and that is, the storage is from +2 to +8 degrees centigrade. And that is also amenable to the vaccine that we're expecting, the AstraZeneca vaccine, which is also stored at that same temperature. So it's not going to be a surprise to us, because we already have the system in place. So what is just left for us to do is to ensure that those facilities are in good condition and they'll be able to preserve the vaccines when they come.
What about the facilitators? I mean, those that will be responsible for the vaccination, the ad hoc facilitators that will go to places, to schools, to homes and all that. We're not seeing any training.
Of course, the statutory agency responsible for ensuring vaccination across the country is the National Primary Healthcare Development Agency, and also in the states, we have the State Primary Healthcare Development Agency. As I speak, a lot of activities are going on behind closed doors.
Across the
yes,
18
across,
local
of course, yes. So you may not be seeing it clearly now, but a lot is going on the ground to ensure that finishing touches are put, to ensure that we get prepared when the vaccine comes. The ad hoc staff are not a problem. We already have them. We have a pool of these trained officers across the states. It's just to, at a click, we call them and they are ready to, go about the activities. We are, Edo State is renowned for, achieving, a lot of successes in terms of routine immunization over the years. And in terms of the first 3 or 5 states in Nigeria, Edo State is part of it. So it's not going to be there's not going to be any drawback when the COVID vaccine comes eventually.
Okay. Now let's talk about the way Edo people, Edolites, take to the acceptance of some of these safety protocols. It seems that people really don't want to adhere. What do you think the issues are?
Well, it's the apathy. People are tired of the long period of this pandemic. Right from, it's almost a year now, and we are still talking about the pandemic. People are tired. There's general apathy. It's expected, and that is why we, on our part, as health workers and health professionals, we are not also resting, because the virus and the pandemic is not resting. So we have to also intensify our risk communication activities continuously, also through the media houses, and ITV is also key to ensure we pass the right messages to our people that this virus is still very much with us. It is still deadly, it still kills. We lost a patient yesterday, the last 24 hours. So we've lost about, yes, in Edo State, we've lost over 140 already in Edo State from the beginning of the pandemic till now. So it kills, and it doesn't have respect for anybody. But it has much affinity for the elderly and those with comorbidities from our data. So that is why we say everybody is at risk. You may not have comorbidity, you may not be aged. However, you have someone who has comorbidity and you have someone who is aged. So everybody is at risk, whether you like it or not. So we must continue to keep safe and stay safe and ensure we put all the measures to prevent COVID-19 into practice actively, so that in Edo State we can be proud to say we have reduced community transmission to the barest minimum as soon as possible. All right,
the adherence to the protocols in some public centers, take for example in marketplaces, is still very much desiring. You go to marketplaces, people they seem to throw caution to the winds and all that. People say that it's a good one that the Edo State government has made it as a point of law, so to say now, that in any public facility you're coming into, you must put on the face mask. But why don't we have this scenario in our marketplaces even now that we have a second wave?
Yes, it's even worse in the past. Right now, it's much better. You recall, immediately after the first wave, a lot of caution was thrown to the wind. people were no longer observing anything as regards COVID-19. But in the course of towards the end of 2020, we picked up again. So as I speak, the state government has, put all machineries in motion to ensure that there is enforcement of the directive by Mr. Governor and adherence to the non-pharmaceutical interventions, as we know. So, and we have been prosecuting a lot of offenders. Mm-hmm. Yes, it will interest you to know that a lot of persons have been prosecuted. Not only eateries or religious organizations, even those in the streets, those in crowded vehicles. A lot of them have been prosecuted. They can do community service and tag the ex-convicts, because we have mobile courts across the states that will immediately try such offenders. So a lot is being put into, enforcement of the COVID-19 directives and guidelines. And Edo State stands out, compared to other states, I must tell you.
Now, when you say an offender is tagged, an ex-convict, some people probably believe that it's just a mere pronouncement.
It's not a mere pronouncement. When you are tried and you are found guilty, you're termed an ex-convict.
Are there records to show that
of course,
an offender is really an ex-convict,
yes,
say 20 years from now?
Yes.
Do you have such data, such information?
Of course.
Such record?
Yes.
Okay. In the judicial system?
Of course.
That's is an offender of COVID-19, is an ex-convict.
The records are there.
Okay.
As they are going about the mobile court activities, they are taking their appropriate data for, keeps.
Yeah, some people also say that the sanctions are probably, too light. You ask somebody to go on 3 hours community service or pay a fine of 2,000.
Yes, it's the beginning of a lot of things to come. As we weigh our enforcement against the compliance, we'll continue to review and see how we can also escalate. Yes, I think it's actually a good way to start.
Okay.
Yes.
Okay. All right, so let's cap it up with what the Edo State government is doing now. There's no doubt that you find the health officials major parts of Benin. But the concern is that we don't find them in rural settings. Take, for example, Far Igara, Far Akoko Edo and all that. We don't find them the way we find them in Benin State. What do you think the issues are?
Yeah, currently there are a lot of strategies being put in place. Of course, that's the truth. In the municipal especially, we have a lot of symbols, signals, and posters, billboards all around indicating COVID-19, and educating the people. But as I speak, there are a lot of activities going on, especially in the rural areas. Just like I said earlier, we're ensuring that we get the community informants at the ward level to go about educating persons as regards COVID-19. Okay, you are aware this is the community transmission already, and it will take, we have over 1,120, 10 per ward, community informants across the state. So these people have been identified as key.
Community informants,
yes.
What do they do?
Yes, their duty and responsibility is to ensure that everybody at the ward level is educated about COVID-19.
Okay.
And when there are persons who are developing signs and symptoms of COVID-19, it's quickly escalated to the local government level, where the DSN, or the Disease Surveillance and Notification Officer, picks it up and ensures sample is collected from that person.
Oh, you have such people on the ground?
Of course. We have a network of surveillance officers across the state, and it starts from the community informant, where we get the detailed information about such persons.
Okay. Now, I want to look into your camera, because whenever I'm privileged to have you guys here, I always like viewers to hear it from the horse's mouth, so that they can actually believe that when we talk about COVID-19, it's so real. You are a doctor and the incident manager, assistant incident manager on COVID-19. What's your message to the people today?
Thank you very much. The message to the good people of Edo State is to ensure that they adhere to all the basic directives and guidelines as regards prevention of COVID-19. COVID-19 is still very much here with us, and is going to be with us for a long time. We are running a marathon, it's not a sprint. So it's advised that every Edolite adhere to wearing of face masks, avoiding crowded places, ensuring you maintain physical distance,